I'm speaking with Victor Windeyer, Portfolio Manager at the Perennial Future of Healthcare Fund at Perennial Partners. First of all, Victor, it's a great pleasure to have you here, and thanks for participating in the Inside Network's Equities and Growth Symposium 2025.
Great, it's terrific to be here, James.
Victor, healthcare is a powerful long-term global theme, but what makes it such a compelling investment focus today?
Oh, well, I think it is a really compelling theme. I mean, first of all, you have this incredible mass ageing event that's happening in developed populations. So we've got the mass ageing of populations, really associated with the baby boomer generations turning 80. If you look backwards for the last, 20 years, 2 decades in Australia, they've been around pretty consistently 20 to 25,000 people turning 80 every year. We're right in the middle of this very sharp transition period where from next year there's going to be 60 to 80,000 people in Australia turning 80 every year, and that's going to roll on for the next 2 decades. This has a massive change in the shape of the population and the healthcare needs of the population. And that's consistent with all Western developed nations across the globe, and that leads to significant underpinning demand. And then the second, I think, key factor in healthcare that really underpins the whole sector and investment in the sector is the incredible innovation and technological change that occurs. The development of molecular targeted therapeutics to treat cancer and other important disease states, medical devices. It's a constant state of innovation, which can lead, these innovations take, maybe 15 years or 20 years to develop, but you get that very rapid transition of that, a diffusion of that new technologies into a global market, which can lead to very, significant increase in outcomes and profits for companies that are at the right point in their evolution.
And of course, a lot of it aided by AI and computational power and the tools that AI and machine learning driven tools can bring to the table. So it's also driven by that theme as well.
Yeah, absolutely. Yes, AI is very interesting in healthcare. Just both on an innovation basis, so bringing new technologies to bear. Genomics and the power of genomics for population health and individuals' health, precision medicine and guided therapeutics, is really underpinned by AI, but also just in day-to-day service delivery. The efficiency of appointments, specialist appointments, is being massively improved by just simple things like automatic note takers, AI note takers, and guidance for physicians on therapeutic pathways, as they're talking to their patients.
Your fund blends blue chip healthcare stocks with venture capital. How do you think about balancing stability with capturing some of that innovation?
Yeah, so for me, that's why we've structured it that way. If you think about the two aspects of healthcare, so it has a very stable underpinning demand profile, but also really exciting innovation. And we like to have both of those factors in the portfolio. Through the economic cycle, there are better times to invest in sort of more growth aspects, and sometimes there's better times to invest in more value aspects. By its sort of nature, if you think about it, the companies that have products that can be diffused globally very rapidly, they tend to, medical devices, biologics, therapeutic companies, drugs and devices, maybe a bit of life sciences companies, they look like growth style companies because those innovations can be rapidly diffused to people all across the globe. And then things that are a bit more local in nature, so hospitals, insurance companies, pathology service providers, medical distributors, those types of opportunities, they look more like value style investments in the portfolio. So there's always a good blend of assets that you can create for the different macroeconomic conditions that you're facing in the future.
What role do healthcare investments play in a broader portfolio, particularly in terms of growth, defensiveness or diversification?
I think there's healthcare is a terrific diversifier because of those underpinning characteristics, the robust demand profile, the inelastic pricing, and the innovation which can deliver that, transformational upside in earnings for the development companies, it is relatively uncorrelated to other industrial sectors. So actually, you can get these very good returns with a lower volatility. So from a portfolio construction point of view, it's actually very, very powerful. And if we think that it's got this strong demand tailwind behind it, then it should outperform further, even more in the future. And so that's where we think that people really need to get exposure to healthcare and have it in their portfolio. It's also global in nature, so that is also a positive aspect, if you like, in terms of having some exposure to that. Australians, by nature, are actually inherently underinvested in healthcare. We have some terrific world champion healthcare companies, Cochlear, CSL, ResMed, but they're really narrow niches actually in the broad healthcare scheme. And what we seek to do is really invest in a portfolio, a carefully curated portfolio of analogous world champion healthcare companies from around the world that might be in diabetes drugs or obesity drugs or treating new devices for cardiovascular disease, and bring that together with some sort of exciting startup companies that have been developed as the companies of the future. So that's sort of our approach to building that portfolio.
We've talked a bit about innovation. How do you identify the most promising areas of innovation in healthcare, and what makes a theme worth backing in the long term? Is it some of those demographic factors that you've mentioned?
Well, the most important thing is it makes a really large, the product of the company that you're investing in, it makes a really very significant difference to the patient that it's treating or that it's using it, because ultimately that will drive demand. And if it drives demand, then you'll have strong pricing for the products, you'll have high margins for the product, and you can cycle some of that back into sustainable competitive advantage and long-term high-sustaining self-growth rates. And that's what gives you that multi-decade growth opportunity that we see in those great companies. When I think about our process, so what we go off to conferences, we talk to clinicians, we have an advisory board. Really it's about engaging with people in different specialties. Certainly we have areas of focus, as we move through time, and different technologies present themselves, that you can sort of see thematics, that become quite popular in an investment standpoint. But ultimately it's about, will this innovation, will this drug, this biologic, this device, this service provide a really great, incredible clinical outcome for patients? And if it is, then it's very likely that will translate into good financial return for investors and for investors in our fund in the long run.
So the tailwinds are very strong for the portfolio. How are you managing the risks?
Well, we have a bit of a risk, particularly at the moment with Trump in the White House. So, one of the things we can do in the construction of our portfolio is move up and down the curve of risk. So if you look historically, healthcare has been an outperformer in the sort of 15 last, relative outperformer in the last 15 downturns and recessions. I don't expect this time it'll be any different. That's largely because people continue, by and large, to take their medicines in times of stress. You see that with diabetics. During COVID, it was a very resilient area of medicine. So you can focus more on that in terms of times of where the market is risk off, and then also there's a time where it's good to take advantage of the fall in prices that you can get in a dislocated market, because everything goes down together. The higher quality things and the lower quality things, investment opportunities, they've all come down, and you can be very selective. There's always selective value in any market, and that's really what we're looking to pick out. So in a more difficult market, it's more about bottom-up analysis and making sure you get that right, that the drugs and devices that you're investing in are really going to be successful, and ultimately that's what will make the returns for your investors. You can position yourself more defensively or more with a growth orientation, depending on the macroeconomic conditions that persist and prevail at any given time.
Victor Windeyer of the Perennial Future of Healthcare Fund, thank you very much for your time today.
Thanks very much, James.